The profession of pharmacy has changed drastically over the past 50 years. Not only has the role that the pharmacist plays in the healthcare field changed, but so has the way that they are trained and educated to help the public. In the past, pharmacists were trained as chemists who would eventually go on to compound medications in a pharmacy setting. Now, the profession has taken more of a clinical-based role and is utilized for their knowledge and expertise in medications. A typical pharmacy in 1963 would have used typewriters to make labels. Everyone paid cash, and the pharmacist would decide how much each prescription would cost. Suppositories were also made on an as-needed basis using cocoa butter. A mortar and pestle were the key tools the pharmacist needed to grind up the ingredients needed for a prescription, which then were spooned into capsules. Although PharmD programs are becoming more prevalent, most pharmacists had a bachelor's degree in order to practice. In 1966, Medicare and Medicaid programs were created, allowing for more seniors on fixed incomes to afford the medications that they needed. Perceptive pharmacists saw this opportunity to expand and created the field known as consult pharmacy, which was used to serve patients and residents in long-term care facilities such as nursing homes. In 1973, the Health Maintenance Organization Act came into play, which later paved the way for managed care organizations to create specific disease state management programs. A clinical focus began to emerge, shifting from products to patients, ultimately sparking clinical pharmacy and specialty roles. Pharmacy school curricula began to strive to include patient contact. In the 1990s, Helper and Strand advanced a new philosophy of pharmaceutical care in pharmacy practice. Pharmacists accepted the responsibility for helping patients to obtain the best outcomes from the use of their medications by encouraging compliance. They also began to take charge of the patient's drug-related needs by focusing more on a medication regimen review. In 1994, pharmacists began to immunize and give flu shots, and soon after that, the pharmacy schools got rid of their bachelor's degrees and switched to PharmD degrees. The innovation of computer technology now allows everything to be automated, making for quicker dispensing times. Almost all medications come manufactured. Telepharmacies allow for pharmacists to reach other areas of the country without actually having to be there physically. Today, there are over 25 specialty areas of pharmacy due to the availability of residencies and fellowships. Medicare Part D now reimburses pharmacists for their services in MTM. The transition in the profession of pharmacy over the past 50 years has evolved in terms of providing patient care, education, and preventative services. Pharmacist roles are expanding with the time and are resulting in a better quality of care and improved outcomes.